fellow Gambians and everyone that is watching us. We are live again today, basically not on the Coronata series. We are taking an interlude on this Coronata series as we look at other issues also. We want to be grateful, obviously, to the Ministry of Health and to every Gambian and to every other person that has been, in one way or the other, heeding to the mitigation measures that we may say culminated into the fact that now we have less cases, both in terms of the positivity rates and also in terms of cases that are admitted for treatment. And as a result, today we want to take some time to just have a short discussion. We will surely continue the Coronata series, hopefully tomorrow, and we will also continue with next week, as the Gambia Christian Council will be leading us through the series next week. But again, as is the intention of this platform, is basically to create a health awareness to the population of the people of the Gambia and to every other person that would have the opportunity to come across this platform to share our thoughts on what we know and also to share things that are actually related to health. And today, there is a title of a discussion that we would take shortly, which is looking at health days in the month of October. Basically, the month of October is full of several health days, and but there are two that we want to be very much concerned about. I mean, we are concerned about every health, but there are two that we want to be want to have some time to discuss. And these two include the following. Now, on the 10th of October, we celebrated or commemorated the World Mental Health Day. And it is very important for us to bring awareness with regards to mental health, to listen to the experts. And because we were inundated by the coronavirus and most of our discussions were basically geared towards awareness in coronavirus disease, thank God that inundation is gradually beginning to settle down, and as it settles down, we will begin to spread our tentacles to look at other areas of health that are equally important. And on that note, we would be looking at some areas of health in neurology, some areas of health in maternal health, some areas of health in different areas. And just to announce, even before we would start those series, hopefully when we are done with the Coronata series, we would look into some two important series, or one that is mainly in neurology, looking at those areas of health that have so much been mystified, and we will try to help demystify them. Notably, we will dive into epilepsy, which is obviously a disease condition, and we know what people's perceptions and their concept toward epilepsy is. We would also look into some other neurologic conditions, notably hydrocephalus, and we do know what people's notion and what their thought and what their beliefs about hydrocephalus is. So we would try to take a look at that. However, soon after that, we're going to take a deep dive into maternal health. If you look today in the social media, of course, it's full of maternal health. You hear the terms of maternal mortality in the Gambia, in other places. We would want to take some time, and this would be done hopefully in collaboration with the Edward Francis Small Teaching Hospital and the key stakeholders, the obstetric gynecologists would come on to share thoughts with the population, to help people, to help our childbearing mothers, give them some enlightenment, some education as to what to do, what to expect, how to know what are the signs and what are the symptoms of certain, red flags and all that. And that's going to be handled hopefully by the Edward Francis Small Teaching Hospital, notably Department of Obstetrics and Gynecology. And so we will be expecting to have that on this platform very soon. Today, however, I just thought it wise to have a look at these two. Mental health. Now, mental health is a great issue everywhere in the world, the Gambia not being an exception. We're going to have a review, having the experts to actually come and discuss also mental health in the Gambia. But I had an expert from the president of the Mental Health Association in Ghana who made a Facebook post, and whom I would like to share what his Facebook post said on the occasion of the World Mental Health Day, which was on the 10th of October. And he made a statement that I think is very relevant to our nation, and I think is very relevant to every African nation. And I just thought it prudent to just share what he has to say. So I would kindly go on and just share exactly the statements that he said, and those are the statements that will bring quite a lot of reflection to all of us, even as we look, at mental health in the Gambia, and as we look at health in general in the Gambia. The major part of the discussion you would see on these presentations. So the first part of our discussion would just be to listen to David and what he has to say. So we'll just go on.
Greetings to all. Good afternoon, good evening, good morning, and good night. Today, the 10th of October 2020, is World Mental Health Day. And the theme for the 2020 World Mental Health Day is greater investment, greater access. What am I here to speak about? Yes, as the National President of Ghana National Association of Community Mental Health Officers, we have been working in hard-to-reach areas across the country, Ghana. When it comes to mental health issues, you can see that we actually need a lot to be done for us to reach a level whereby each Ghanaian will have a fair share of whatever services that we provide. Looking at the theme for the year 2020, greater investment, greater access. May we ask ourselves whether we have done much investment into our mental health and whether we have access in our mental health. From my perspective as a practitioner, we have come to a point that we still need a lot to be done, though some kind of successes have been chalked. When you look at Ghana and also the West African sub-region in terms of mental health policies, Ghana has done tremendously well, but we still need a lot to be done, because when you look at the 2012 Act that was passed, and looking at the LI that has also been passed in 2019, a lot still needs to be done. We still have mental health not being funded as enough, logistics constraints, and the likes. Professionals, though we, the mental health officers, have been trained, our numbers are still inadequate to be able to support the entire population, because as I speak, we are about 700 plus, and Ghana, as we speak, we have a 30 million estimated population. When you do this calculation, it means each community mental health officer is taking care of 42,000 plus population, which in a year we cannot handle these numbers. So we need more mental health officers to be trained. When we move from there, we need capacity building for other cadres of health professionals. We know psychiatrists. We also have very scanty numbers. Psychiatric nurses, the numbers too are not great. What do we have to do as a nation? We need to look at how best we can train more professionals, psychologists that are involved in mental health care. But my concern is on the team, greater investment, greater access. Has Ghana done greater investment into our mental health care? Do we have that greater access in Ghana? Do we have clinics and mental health units dotted in sub-districts, of which I know is a good call and is a good initiative that Ghana is implementing through Ghana Health Service, but we still need a lot to be done. So as an advocate, as a practitioner, and someone who is much interested into mental health, at this point, and today being a special day, I am calling on whoever that is concerned to give a second look at our mental health care. The government of the day should support and fund mental health. The parliamentarians, and we also look at how best the Parliament of Ghana can decriminalize attempted suicide and suicide. When someone is about to commit suicide and he doesn't succeed per our laws, the person needs to be taken on, but this person needs psychological support. So I think our laws must look at this and decriminalize suicide, because those who made those laws with us and for us, they have decriminalized them. That is the United Kingdom, Britain. They have decriminalized suicide and attempted suicide. So why are we still holding on to those laws? Yes. So moving from here, I would like whoever will get opportunity to watch the video that the causes of mental illnesses are multifaceted. The biopsychosocial approach. So it is not just one thing that will happen to one person and the person will be having mental illness. There could be a lot of things that is happening. So when we look at the biological factors, the chemical imbalances in your brain, we look at your psychological issues, we look at your social and your cultural upbringing, all those things contribute to what at times lets people suffer from mental illnesses. Yes, so, and 1 out of every 4 persons is likely to have mental illness by World Health Organization. And as we know, globally, about 264 million people have depression. So these numbers are quite great when we're looking at, and when you look at schizophrenia, about 21 million people. But I actually want to look at the statistics Ghana have from Mental Health Authority. I think University of Ghana and Yale also did a research, and the figures ranges from 10.1% to about 14.77% of the entire population likely to be suffering from mental illness. So you and I out here, we are all not immune to getting mental illness. And all of us listening at this point in time, each of us have a family member that is suffering from mental illness. The person could not, be diagnosed now, but could be suffering from the condition. So we all need to give a second look at mental illness. Let not stigmatize whoever is having mental illness, because mental illness, it could be you. So today is a special day that I think each and every one of us who live on this planet Earth must honor and give it a chance to also look at his or her mental health. Because when was the last time, or when was the first time you took it upon yourself to go for mental health assessment? Yes. So let us build this particular initiative and also courage to be going for mental health assessment at least twice a year, like how you've been going for dental assessment, general body assessment, because it is your brain that controls almost every part of your body. The way you work, the way you think, the way you do everything, the way your heart beats, the way you urinate, everything, it is about your brain. But we least care about the functions of our brain and how our brain works. So as an advocate, yes, 2020 is a year of change. In 2020, we must all change for good. In 2020, let us give a second chance. Let us give a second look at our mental health care. Let us support and fund mental health. I was saying that even with a 50% support, a month or even a whole year from each Ghanaian that we have, we can fund mental health. But what do we see? When we see voluntary donations, it becomes hard. Yes, I know one day, it will surely come into fruition for we having full support from government, full support from stakeholders, full support from donor organizations to funding mental health. May God bless each and every one of us who will have the opportunity to watch this video. Once again, this is David Naboare, the National President of Ghana National Association of Community Mental Health Officers. I practice community mental health. I work with Ghana Health Service in the KGB district, Oti region, Republic of Ghana. Thank you very much.
Yeah, thank you so much. It's quite very interesting to hear the speech by David. David, who is the president of the Ghana National Mental Health Association. And that was why I was saying that this discussion that he has made is indeed relevant to our context. But again, to just promise all our viewers that we will also have on board in the near future a discussion on mental health, and where we will invite the experts in mental health in this country and anyone abroad or people that want to participate to come and discuss on the burdens of mental health care in the Gambia. David made a plea, and I think that plea is valuable to every nation. And to the Gambia, again, I would say the same thing. Today, basically, we're not talking more on health talks. Today, I think we're doing more of advocacy, which is all part of it. And I think we all have a role to play in advocacy because the more we have support, the better it becomes. So David talking about the team in their context, and if you look at that team, it only tells you that more investment, more access, more investment, more access. And he took the time to even give some few analogies of if everybody would contribute a small amount, that would go a long way to change mental health. And I think if I bring that back to the Gambia, my homeland, and I say, if every major institution in this country would take it upon themselves, having learned from COVID and the impact that it had on us, and the impact that it will obviously continue to have on us, and say that, look, every single institution, strong major institution in the Gambia, talk about the banks, talk about the cell phone companies, talk about other areas, talk about GRA, talk about security, talk about that, say, okay, you know what, we want to take it upon ourselves to sponsor one single specialist in the Gambia, just one, whatsoever it's going to cost us, whether it's going to be here in the Gambia, whether it's going to be in Senegal, whether it's going to be in Africa, other parts of Africa, whether it's going to be in Asia, in Europe, or whatever. Just say, okay, you know what? We want to take it upon ourselves to sponsor just one single specialist in the next 5 years or 6 years. That will change the dynamics of health in this country. And that also goes a long way to say that everybody needs to come on board in terms of health. Government alone can't do it. If we leave everything to government, then we will still have the same problems that we're going to have, because government is limited and government has a lot in their head to do. And I think it is the duty of every other individual, every parastatal, now to just invest. So my challenge to every institution in the Gambia, having learned from COVID, is to say, look, you know what? At every institution, just take one person and say, look, we want to sponsor one person here. So one institution sponsors a cardiologist, okay? Another institution sponsors a cardiothoracic surgeon. Another institution sponsors a neurologist. Another institution sponsors a psychiatrist. Another institution sponsors an endocrinologist. Another institution sponsors a gastroenterologist. Another institution sponsors, that's that. There are just so many. In fact, if we do that, maybe it could be 2 per specialty. And before you notice it, in the next 5-6 years to come, you would have a country that is full. And looking at our size, we are small. We would be able to beat that ratio, high patient-doctor ratio. Right now, if you take a look at the Gambia, I mean, if you look at it from the general hospital perspective, most specialties, I would say, it's almost zero. Sometimes you have 0 to 2 million people because you just don't have them. So 0 to 2 million people, you just don't have them. And those that you have, you don't have them many. They're not many. You know, you go to general surgery, you have a number that is there that is working. You come to urologists in the Gambia, as far as I know, those working currently in the Gambia, I would say 1 to 2 million, and it's not public, it's private, who does obviously work in the public sometimes, except for the grace we've got from the Cuban government that have given us some a urologist with us. But if you look at it, Gambian urologists to the population, it's 1 per 2 million. Okay. When you talk about obstetric gynecologist in the hospital, in Edward Francis Moore Teaching Hospital, when you talk about Gambian, you know, consultant obstetric gynecologist, you may be talking about 2 per 2 million. That is 1 per million. And when you talk about specialists, obviously you would have a good number of them. More, and I'm not too sure, so don't quote me for the specialists. A good number, some of them have been added, maybe about 5 or less than that, but don't quote me for that. Per million, you know. So when you come again, talk about so infectious disease specialist in the Gambia, you're talking about somebody that's working from the government perspective, talking almost about in Edward Francis Small, it's going to be 0 to 2 million. Of course, if you add others, MRC and other areas, then you will have a small number. Okay, when you come to my own area, neurosurgery, fortunately, with the loss of Dr. Jones, you have 1 to 2 million. So you can imagine one person being responsible for 2 million people. And there is just no way you can provide care that is adequate for them. And those constraints are the constraints that we have. And sometimes people would follow you for you to do something for them that may not be, but the time is not even there because you're concentrating on 1 thing or 2 things or 3 things because you were alone. So that is a heavy burden on our health system. So David gives us a very insightful thought, and I thought it would be important to share that with every Gambian that is listening, that if every single stakeholder, everybody, as your corporate social responsibility, having come out of COVID, if every institution would say, as our corporate social responsibility, having come out of COVID, we will sponsor 1 specialist. It's a long-time training to get a specialist, yes. Minimum 4 years, 5 years, some 6 years. We will sponsor him to the end and then get him back. We will change the story. From the previous regime, we saw the medical school came into being. They stood by it, ensured that it worked, and that has produced dividends. So that today you go to different parts of it, you are meeting doctors. Yes, they may not be specialists, but you are meeting qualified medical doctors who will be able to see you and be able to assess you. And if you need another specialist, they'll be able to provide. And in fact, some of them have been given so much training that they're almost acting in some other capacities as specialists because of the training that they are having on the ground. So if we would continue that trend to say, okay, you know what, we've got a number of doctors that have been trained. Now what we need to do is to make sure that we work extra hard on the specialists. That's what we need. and everybody comes on board, what is it that is needed? If you do not know, go ask the Ministry of Health. They will give you their list, and I'm sure. But if every institution, as part of their corporate social responsibility, learning from the impact of COVID, would say, look, we would take it upon ourselves to sponsor one specialist, we will change the dynamics. Thank you so much, David. The second area that we want to just say before we conclude today's talk is World Spina Bifida Day. So I want to announce that the World Spina Bifida Day is coming on the 25th of this month. I'm sure, just want to have a look to see, because some of these terms may be a little bit sometimes these terms, we take them for granted, but not everybody is familiar with these terms. And so I just want to see if I could have a simple image that I would want to show basically as I do this presentation. So the World Spina Bifida Day is coming on the 25th of October. And I am very thrilled to invite on this platform a very, very important foundation who has taken it upon themselves to sponsor kids with spina bifida, hydrocephalus, and other neurocongenital malformations. And this is no other than the Lamin Keita Hope non-profit organization. The Lamin Keita's Hope non-profit organization, it's a non-profit organization that has been championed and founded by the Keita family in Charlotte, USA, out of a personal experience, having gone through the burdens of this disease. They thought it very, very prudent and as a national and a personal responsibility to contribute their own quota to the children with spina bifida and also to families with spina bifida. And as a result, from the 1st of July 2020, they started what we call a holistic management of patients with spina bifida in the Gambia. Unfortunately, this was aborted by the surge in COVID-19 cases, where this program actually had to almost come to a halt. And as we resume working, again, there is a resumption of that whole process, though not as full as we had it before, but most of the things that the patients would need that would cost them quite a lot have been covered currently. And so on the 25th, we just want to remind everyone, and we'll also bring about the advert, that the World Spina Bifida Day will be commemorated, and we will be on this platform. 25th is basically going to be Sunday coming next. Yeah, and we're going to be on this platform to create awareness about kids with spina bifida. Mothers and families that have children with spina bifida go through a lot of pain. And sometimes a simple knowledge and a simple explanation of what it is, suffices. It helps a lot, because otherwise you find out that people keep going about looking for some form of solution, where they want to find that solution or not. And sometimes they don't know the other extra care that is basically involved in the management of kids with spina bifida. So we would have it upon ourselves to take time to make sure that we inform everybody about spina bifida. How common is spina bifida in the Gambia? I want to say it's very, very, very common. Also, we do know that there are other, if I may say, there are other things that people can have to be able to reduce the incidence of spina bifida, such as the use of folic acid. And those are the things that we would want to use to actually communicate to the people. So part of the things that we are going to have is to just discuss basically what spina bifida is, what treatment options are available for us here in the Gambia, and also for people to know, and not only for even the mothers to know, for other healthcare workers to also know, so that once you come across such type of patients, you know, you are able to quickly send them to us, and we are able to have a look at them, and then, you know, we can give them the care that they need. So World Spina Bifida Day is coming 25th, Sunday coming next, and we're going to be on this platform with our good team, the team that is from the Lamin Keita Hope non-profit organization, Fatu and her team, and also we will also obviously be joined by the local chapter that is here, myself, our able treasurer and secretary, Mrs. Hadi Job George, who will be with us also, and our PRO, Mr. Modulamin Kamara, with the whole team from the US, the CEO, who is Fatu Job, and obviously her husband, Dudu Keta, and the others in the team, veteran people in the team, Bakari Dabo, and also Faba Kijera, and my our able Dr. Chernoba, amongst others. We will be live as we discuss on the issues in spina bifida and hydrocephalus. So I was just trying to have a look. So basically, this is what you see. This is what we call a spina bifida. These are children that are born with a form of a birth defect. And sometimes that birth defect can be very, very costly because it can affect the nerves and on the lower back. And sometimes these very nerves are responsible for feeling, these nerves are responsible for walking, these nerves are responsible for, you know, urinating, these nerves are responsible for going to toilet properly. And so if you can imagine these nerves all being damaged, it means some of them, not all of them, but some of them, and severe cases we see every now and then, may not be able to control their stool, may not be able to control their urine, and may not be able to walk. And therefore, they would need throughout their lifetime a specialized form of care. And this is basically what we are trying to produce and what we are trying to offer with the Lamin Keita Hope non-profit organization. So we hope to see all of you on the 25th, you know, as we discuss these cases. And on the 25th also, we would show for everybody that have a patient, a relation, or that has this, their numbers to call, and it is easy. You will just need to get to Banjul and you would be seen. However, even if you don't call those numbers, all you need to do is just present yourself to the pediatric hospital in Banjul, where you will be seen and you'll be directed to the appropriate people that will take good care of you. What we do is to register all patients that want to be registered under the foundation and to be responsible for most of the things that they would need, because sometimes these conditions, even after operating them, they may also develop some other complications like hydrocephalus, you know, and those that would have hydrocephalus would therefore need other additional surgeries, some of which the cost may be expensive and it's not within the reach of so many people within our country. And so the foundation is here to help these people. We are able to buy the shunts for them. And just to say, recently with the breakdown of CT scans in all the government facilities, we only have a CT scan, thank God, from the private, and I think also obviously thank God for that, because if we never had a CT scan in the private, then it would have been another catastrophe. But again, if you look at it also, if you need to get a shunt and you need to get a CT scan, all in all, you may be spending nothing less than $10,000, you know, for just the two things that you would need. So we can't be more thankful to the Lamin Keita Hope Nonprofit Organization. And I also want to take this moment to say that look out for the Lamin Keita Hope Nonprofit Organization. They're on Facebook, they're on YouTube, they've got a Twitter account, they've got a GoFundMe account. Support them because they're doing quite well. Those of you that want to know what we are doing, you can always pass by in the office, and in the office you can be shown the total number of people, the people that have registered, and what we've done for them and how much has been spent and all that. And I'm sure that will encourage you to be a regular donor and a regular help to the Lamin Keita Hope Nonprofit Organization. So 25th of October is the day. Please tune, and you will meet with all the people. You will meet with the CEO of the Lamin Keita Hope Nonprofit Organization. You will hear him, and if you also have some questions to ask, we will be live Facebook and YouTube. You can always ask your questions, and we will be there to give you help. More importantly, those of you that have families, that have kids with spina bifida and hydrocephalus, don't keep them in your homes. Don't condemn them. Okay, just bring them. There is no, if you're living within the confines of the Gambia, you don't need any other thing. Traditionally, people would say, oh, when you get to the hospital, you got to know somebody, and I don't see that in my practice. You don't need to know us for us people to manage you. We manage everybody. All you need to do, just follow the path. And the path, we said, it's simple. If he's a child, take him straight to the pediatric unit. Once he's seen at the pediatric unit, they will ask him to go somewhere. They will ask him to do that, and you will land in our hands. And with the help of God, we will give you the services that we are able to offer. So either if you want, you could give a call, but if you don't need to give a call if you're in the Gambia. If you have a child that has spina bifida, just get to the pediatric unit in Edward Francis Small Teaching Hospital. You will surely come to the right place that you need, and you need to be managed. Secondly, again, and I still want to ask on everybody, let's get back again to what David said when he talks about mental health. More investment, better access, better investment, better access. And the challenge also goes to everybody. If you can support the Lamin Keita Hope Nonprofit Organization, they are doing a great job. They're doing a fantastic job. They're doing a phenomenal job. Since when we started working with them, life had become very easy. With us, life had become very easy for our patients. The follow-up had been much better. The number of cases we have operated had increased within that very short period of time. Of course, everything has been shattered in some way, but not totally destroyed. But in some way, everything has been hindered by COVID. But thank God, COVID is gradually fading away. And as it is fading, we are coming back again. And this time around, we are coming back with strength. And with your support, all these things could happen. So I hope that makes sense to all of you today that are watching. I want to thank you also for joining us. Just to say that the Coronata series has not yet completed. We are still on Coronata with coronavirus disease with religion, and that's surely going to continue hopefully tomorrow. And from Sunday onwards, there will be Gambia Christian Council that will come. And once they finish that, we will discuss some few topics, like I said, demystifying health. Again, don't forget, Sunday coming next, 25th October, it is World Spina Bifida Day. So you'll be here with the Lamin Keita Hope Nonprofit Organization. Don't forget that. However, after that, what we are going to have is going to be talks on certain health conditions that people have mystified in our own part of the world, and to see how best to demystify them. Immediately after that, we are going to have the big topic on maternal health in the Gambia. And it's going to hopefully be led by the Department of Obstetrics and Gynecology, Edward Francis Small Teaching Hospital. Having said that, I want to wish you all a fantastic weekend. And till I come your way, thank you all.